Welcome, and thank you for participating in Return to Work training. This training details our commitment to you should you suffer an injury or fall ill while at work. A program that promotes an early and safe return to work for workers who have been injured or fall ill is an important part of a comprehensive health and safety program. We will provide a modified work program to any of our injured or ill employees until he or she is able to return to their pre-accident job wherever possible. There are two different types of return to work. The first one is work reintegration. This returns a worker to work that he or she has the skills to perform, is consistent with the worker's functional abilities, and that, to the extent possible, restores the worker's pre-injury earnings. Ideally, the worker will return to the pre-injury work. The second return to work type is reemployment. This reemploys an injured or ill construction worker who has been unable to work due to a work-related injury or illness. Reemployment commitments remain in place until the earliest of the following: the second anniversary of the date of injury, 1 year after the worker is medically able to perform the essential duties of his or her pre-injury employment, the date on which the worker declines an offer from the employer to reemploy the worker in accordance with this regulation, or the date on which the worker reaches 65 years of age. As part of our commitment to this program, Hawkins Contracting Services commits to contacting you as soon as possible and remaining in regular contact should you suffer an injury or illness. We commit to communicating with the WSIB on your behalf, to paying full wages for the day or shift on which the injury or illness occurred, keep clear records of your injury or illness, assess each individual situation according to any practitioner's report and recommendations, and provide some kind of modified work to suit the degree of injury, and assist in the employee's active recovery and encourage the worker to return to work to their pre-accident job wherever possible. We also commit to identifying jobs that are suitable for accommodating you on a temporary basis in order to facilitate the early and safe return to work program and limit any loss of your earnings. This means giving consideration to modified work duties that align with your functional abilities and skills. When assessing modified work duties, Hawkins Contracting Services will consider possible changes or modifications to the job or workplace so that the work is within the injured or ill person's functional capabilities and the risk of injury is reduced. These reconsiderations will become part of a plan that also details the expected duration of the accommodations, allocation of funds to exact the plan, the location of the plan that may be new to the employee re-entering work, and any further assistance or services required to execute and maintain the plan. Changes or accommodations can come in many forms. Here are some examples: reduced or graduated early and safe return to work hours, reassigned duties, restructuring the job, more frequent rest breaks, stretch breaks, chairs with advanced ergonomics, anti-vibration tools, making heavy tools available at waist height, light shop work and general cleanup, light work with brushes such as painting trailers and containers, washing trucks and equipment, pickup or delivery duties, training in your selected field where possible, and computer training in safety prevention if available. The detailed selection of modified work duties will be recorded on the early and safe return to work offer of suitable work. The early and safe return to work offer of suitable work document outlines your detailed return to work plan. It is in keeping with your medical practitioner's recommendations, our legal obligations to you, the personal interests of you and the company, and most importantly, your quick and full recovery. As part of this program, we require all workers to commit to these duties. Notify the supervisor or management immediately of any injury or illness. Stay in regular contact with management and health practitioners as required. Help identify and cooperate in suitable work arrangements. Provide WSIB with information as required. Return to work within 24 hours with completed WSIB forms to develop with the employer an early and safe return to work. Choose a doctor or qualified practitioner, but please note a change in doctor cannot be made without permission of WSIB. And in general, participate in the early and safe return to work program. If you are unable to return to work immediately after your injury or illness, we pay WSIB premiums to ensure you are compensated for loss of earnings. This compensation begins on the day following the date on which you suffered the injury or illness. WSIB pays workers 85% of their take-home pay if they cannot work because of work-related injury or illness, up to a maximum insured wage of $84,100 as of 2014. This pay is adjusted annually for inflation. Benefits continue until you are no longer impaired by your work-related injury or illness, or until you no longer have a loss of earnings, or until you reach age 65. In summary, Hawkins Contracting Services is committed to returning all injured or ill workers to work as soon as possible. We are committed to assisting all employees in minimizing wage losses. We are committed to assisting employees in achieving quick and full recoveries from injury and illness. And we expect everyone's full commitment and honesty in achieving these goals. You've reached the conclusion of this training presentation. Thank you for participating in Return to Work training. Please proceed to the next training presentation.